Hello, I'm Jeremy Chataway. I'm a consultant neurologist at the National Hospital for Neurology and Neurosurgery, UCLH Trust and UCL. Multiple sclerosis is a disease that affects about 2.5 million people in the world, about 120,000 in the UK, particularly young adults. People with multiple sclerosis have attacks, and they're called relapses, when they can become disabled, they can lose their eyesight, they can become paralysed, and they can lose their balance. One of the causes of this is infection, particularly urinary tract infection, so infection of the urine and the bladder. And we know from recent work that this is quite a considerable problem with people coming acutely into hospital with serious consequences of the infections, which ultimately could have a catastrophic result. Detecting urinary tract infections is a major problem. It's very difficult to get timely results in terms of what the bacteria is and what the sensitivity or which antibiotic that bacteria is. It typically will take a couple of days. So therefore it may be that patients have to be treated blindly or may lose those 1 or 2 days until those results come in. And what we're trying to do in this project is to speed up the diagnosis using advanced engineering technology. I'd like to hand you over to Manish and Stavrula to discuss the engineering aspects of this project.
Hello, my name is Stavrula Balabani. I work in the Mechanical Engineering Department at UCL, and my field of research is experimental fluid mechanics. E. coli can swim, and they also saw some interesting behavior near interfaces, whether they are liquid-liquid interfaces or solid-liquid interfaces. We hope to explore this behavior and develop a fundamental understanding of their swimming and use this information to develop some biophysically based diagnostic techniques. We will do this by using some laser-based diagnostic techniques, for example, particle image velocimetry or particle tracking, and we're going to use this information to develop some miniature sensors that will detect infections rapidly. We have applied these techniques to a wide range of flows in process engineering as well as in biology. And this will be the first time we will apply these techniques to solve such an important problem for MS patients.
My name is Manish Tiwari. I'm a lecturer in Mechanical Engineering Department, and I work in the area of using imaging techniques for fluid mechanics. We will start by using laser-based diagnostic techniques to understand how bacteria swimming works in catheters and sample pots, and then think about how we can use these fundamentals that we learn in the process to develop a new point-of-care disposable imaging solution by using a regular smartphone and its LED, which will make it very inexpensive and hence cut down the time that it normally takes to detect bacteria infection in urinary catheters. So at UCL, we have world-class expertise in imaging and fluid mechanics techniques, which is directly relevant to the engineering solution part of this project. In addition, we also have a clinical experience of Institute of Neurology team who deal with MS patients on a day-to-day basis, which should make this project an especially fascinating one.